There are over 800,000 deaths globally due to suicide, and for every person who dies by way of suicide, at least 135 people are impacted through grief, which equates to over 108 million people worldwide. 2018 data shows that more than 48,000 people suicided in the U.S. and over 1,500 in Michigan. In Wayne County, there were 225 deaths by way of suicide. The numbers continue to climb, and with COVID-19, the numbers are expected to grow even more. There are many myths associated with suicide. Here are a few. Suicide is inevitable. Once someone says they are suicidal, you can't stop them. The reality is that talking about suicide helps bring relief to the person, allowing them to talk more about it and feel less anxiety. Another myth is that only experts can prevent suicide. Not true. Suicide prevention is everyone's business, and everyone can help prevent suicide. We have come to understand that we cannot do this alone. The more people know, the more they can help. Hagera Health recently received close to $800,000 from a SAM-HSA grant to address gaps in service with its Pathways for Suicide Prevention program. The three primary areas of the grant are clinical, training, and outreach. Clinical services include mobile crisis stabilization teams who work with suicide attempt survivors by engaging with them while they are in the hospital, being involved in the discharge process, and providing evidence-based treatment for suicide prevention. We also work closely with First Step, a domestic violence and sexual assault organization, to help with the suicide crisis. The training components include a trainer of trainers approach. People will be trained to be master trainers in QPR, question, persuade, refer, suicide prevention training. QPR is a 3-step, evidence-based practice designed to help people in the community become gatekeepers and help people who are suicidal get the help they need quickly. As master trainers, we can train individuals to become trainers. The more trainers we have in the community teaching others in QPR, the more lives we can save. The suicide prevention program's outreach component includes working with community providers, organizations, and agencies to provide training, community support, education, and awareness programs. Hagera Health will also be hosting a conference next year on suicide pre- and post-vention, and will soon begin hosting support groups for attempt survivors. Hagera Health is leading the way to making zero suicide a reality. With your support, we can make a difference, together.